So, when looking at this neonatal chest and abdominal radiograph, the first thing I notice is the lines and tubes. The cardiac monitoring leads and nasogastric tube seem to be in good position, so no issues there. But what stands out to me is the central catheter. I can see that it's kinked in the right atrium and crosses over the midline, projecting over the left atrium. This makes me think it's passed through a patent foramen ovale, which, as we know, can be problematic. Now, the catheter tip is positioned in the left atrium, and this is really concerning because it puts the baby at significant risk of systemic embolization. My immediate thought here is that I would need to inform the clinical team right away and recommend repositioning the line. We'd want it ideally in the superior or inferior vena cava to avoid any complications. Moving on to the patent foramen ovale, which is quite common in neonates. Normally it's not a problem, but in this case, the fact that the catheter has passed through it into the left side of the heart raises the risk of embolic events, which could be dangerous. Now, when I look at the rest of the film, the cardiothymic contour seems normal for this age group, so I don't see anything abnormal there. There's some parahilar haziness, but I think that's nonspecific, and most likely due to the baby being in a supine position, again quite typical in neonates. There's also external tubing over the lower abdomen, but that's not causing any concern. In terms of management, the most pressing thing would be to retract the catheter to the correct position, either in the superior or inferior vena cava, depending on the insertion site. That would reduce the risk of embolism and prevent further complications. To sum up, this case really stresses the importance of carefully checking the position of lines and tubes in neonatal radiographs. If a catheter is mispositioned, especially when it crosses into the left atrium through the patent foramen ovale, it can cause serious complications like systemic embolism. This is why detailed and careful radiological review is so critical in neonatal care. Oh, and if you want more cases like this explained simply, I recommend checking out Radiology Made Easy on YouTube. It's a great way to reinforce these key concepts in a clear, approachable way.